When you look at the circumstances surrounding the death of 23-year-old Lucrecer and how the doctor and the clinic responded, the only thing that comes to my mind is, what the hell were they thinking? This is Christina with the Sisyphean Journal, and today is November 4th. Now, Lucrecer was a 23-year-old mother of 5 and 12 weeks pregnant when she went to reproductive services in Dallas on November 4th, 1977 for her safe legal abortion. Now, she began hemorrhaging, and Dr. Robert Gardner, who had performed the abortion, said that he ordered blood for a transfusion instead of calling an ambulance. The blood wasn't arriving, and it wasn't arriving, and it wasn't arriving. Okay. He transfused her with his own blood, which was an incompatible type and only made things worse. Now, I don't know whether it was Dr. Gardner who made this decision or whether it was somebody at the clinic that contracted with him who made this decision. But instead of calling 911 to get the fire department ambulance, which is the only ambulance approved for emergency services, they called a private ambulance. Now, the private ambulances were only allowed to do transports of stable patients. So they had no idea what was happening with this young woman. They just figured it was a routine transfer. So it took a while for them to get there. By the time the ambulance got there, Lucrecer had already gone into cardiac arrest. And of course, the crew's like, this is an emergency. What in the world were you thinking? Now, rather than delay by calling the fire department ambulance, they decided, rules be damned, they were going to transport this young woman. Unfortunately, Lucrecer died that day. Now, Gardner requested that the body be released without an inquiry, but a doctor at the hospital learned of the case and he requested an inquiry. So an autopsy found that she, of course, had hemorrhaged massively. It was at least 2 liters of blood. And there was a 1.8 by 2 centimeter ragged perforation in the right lateral wall of the uterus, just above where the cervix entered the uterus. And the endometrial surface of the uterus was ragged and hemorrhagic. So death was attributed to hemorrhage due to perforation of the uterus during an abortion. Now, another patient, a 21-year-old woman named Claudia, petitioned the state to close the clinic. When the state went in and looked at things, they found out that the clinic was allowing people with no medical degree to give medical advice and perform medical procedures. The staff were not informing the patients of risks, and surprise, surprise, there was no emergency equipment on hand. How many times have we seen this? Now, Gardner himself was one of the people who testified against the clinic. He said they ran an assembly line operation, which, yeah, big fat hairy deal. That's how they do it. Edward Campbell Allred of Family Planning Associates Medical Group was credited with inventing the assembly line abortion. He prided himself in being able to do abortions in 5 minutes. Quick turnover. Churn them out quick. One of Allred's admirers said that he did for abortion what Ray Kroc did for hamburgers. And I think he doesn't just mean in terms of speed, I think he means in terms of marketing. Now, Gardner admitted that the clinic only took 1 or 2 minutes between operations and used black tarnished surgical instruments and switched sterile gloves between patients but never scrubbed down. And this is another thing that we commonly see, where these doctors are in substandard clinics and they go ahead, what the hell, it's abortion. So while the transfusing with his own blood and calling a private ambulance is a little bit different, the dawdling before sending the patient to the hospital, the substandard care, And the fact that a subcontracted doctor is like, whatever, that's how they do things here, is common. And if you follow the Sisyphean Journal or the Real Choice blog, or you go to the Cemetery of Choice website, which is a hot mess right now, we're revamping it, you'll see that these are not uncommon things. And I really, really, really wish that pro-choicers would get their knickers in a twist about it. But they're too busy trying to find out whether pro-life pregnancy centers give information that they don't think women should be allowed to have before their abortions to actually care about whether the abortions themselves are being performed safely.